Well, the Institute of Women and Ethnic Studies, that we lovingly call IWES, we are a community-based public health organization.
Since 1993, the mission has been to improve quality of life and health for women, their families, and their communities through educational outreach programs. But post-Hurricane Katrina, they identified a major need that was not being addressed.
As you can imagine, there was a lot of focus on rebuilding the physical environment, but we felt that it was important to look at people and how to help rebuild their resilience.
They realized the issues young people were battling went largely ignored.
As bad as it was for adults, it was probably twice as difficult for young people because they didn't have a chance to talk about it. No one really thought anything was happening to them so long as they kind of attended to their needs.
In 2012, IWES began working directly with students at the school level with a focus on identifying and mitigating the stress in their young lives.
We decided that we were going to screen them to see the levels of post-traumatic stress disorder, depression, what their exposures were to violence, because violence began to increase in the community, and what they were worrying about.
They collected data for 3.5 years, interviewing more than 1,300 young people. The findings were alarming. 51% of kids surveyed had lost someone to murder, 18% actually witnessed the murders, and 41% were exposed to domestic violence, all of which makes them more vulnerable to PTSD and depression.
Our young people are endorsing symptoms of post-traumatic stress disorder. That's 3 times the national rate, and at the rate that you see from combat veterans coming back from Iraq.
Dr. Shervington says, in essence, the children had been through a war zone with limited services available to tend to their needs. IWES started a campaign called In That Number to put faces to the stories of the 1,300 young people.
So what we're trying to do is to soften the perception. These kids are not criminals, they're not bad. They're whole human beings with traumatic disorders, and they need psychological services.
Using billboards and engaging the community through social media with the hashtag #SadNotBad, they are inviting people to learn more about the narrative, data, and the work being done.
A majority of them, the ones who are acting out and many of whom are being pushed into the criminal justice system, that these kids really are sad and they're not bad. They have a lot of emotional pain.
IWES is also engaging with Metropolitan Human Services District to be the planning body to organize mental health services to address the psychological needs of young people.
I feel like we're the community voice for them, trying to advocate for needed services, mental health services, and not just quantity, but quality trauma-informed services for young people.
So what's in these numbers will not continue to be ignored. Reporting for MHSD, I'm Casey Ferrand.